Is your vertigo coming from your neck? That's the subject of this video. You got to understand first what vertigo is. Vertigo is basically spinning, and it is linked typically to the ear. So you go and get your ears checked and they find that everything is okay. So then what is it? It is most likely what is referred to as cervicogenic vertigo. That means neck generating vertigo. And that is something that is typically caused from bad posture and neck injuries. Limitations in the neck movement itself causes vertigo. So some of the signs is when you look down, the symptoms get worse. A lot of times we're looking at our devices, at our phones or whatever the case may be. You can have neck pain and vertigo, headaches and migraine headaches when they kind of happen together. You have to also understand that vertigo basically creates a lot of tension in your neck. So that tension by itself causes tension headache, it causes tension in the neck muscles. So what do you do about it is then the question you may have. In order to really address the cause, we want to obviously have a better movement in the neck area. That means that a lot of times we need to actually go to those end ranges of movement in the neck area that we typically don't have because we go through the same movements each and every day and not to those extremes. The way I explain it is in your ear, you have the semicircular canals. There are these canals that are set in such fashion that your brain can tell if you're moving in the forward backward movement, the side to side, or diagonally in that direction. When you have limitation in your neck movement, then the information which comes from your semicircular canal are not transmitted, they're not created in those canals. Those are kind of like those bubbles in a level that when you see if something is straight. When that doesn't happen, the brain doesn't get the information. So you go through that whole spinning process. That is typically what is happening. It doesn't necessarily have to be the case. So what are some of those exercises? The isolated exercises that I suggest, and I typically suggest for people to do when they're sitting on the toilet, is you want to be able to bring your ear to your shoulder. So what matters is for your shoulder blades to not be rolled forward. So you want to be activating your shoulder blades to be going backward without you sticking your chest out. Then bring your ear to your shoulder, and as you're going through that, start turning your head as if you're trying to see a spot right there. And then you go back and bring your head back and look up and go through this whole range. Then you can go through rotation all the way from one side to the other side. Typically flexion extension, there people don't have as much limitation. However, when you bring your chin up and you go through flexion of your neck, and when you bring your chin down, and then you go as if one vertebra at a time, you come down. And then once again, you go to the other side. So you go through ear to the shoulder as much as you can and start rotating your head and coming back and rotating and coming back. Typically, the restriction is in higher levels. Now, you got to understand if you're feeling dizzy or you're feeling nauseous, you got to stop because that may be something else, and that something else can be dangerous. So, you have to, if that's the case, see your healthcare provider and explain what has happened and make sure that the blood vessels here are intact and they're in good shape and they're safe. So that's one of the isolated exercises you do. Generally speaking, I'm a huge fan of functional mobility exercises. Those are exercises that involve your whole body. Why the whole body when the issue is in the neck? Because your neck is related to everything else. And many times it's lack of, not many times, always, its lack of performance is picked up, that task is picked up by the rest of your body. Many times the neck becomes restricted because it is doing, it's modified its own version of doing things because it had to adapt to a lack or dysfunction elsewhere. When it comes to functional mobility, I suggest people to look at it as playing a concert. While the spotlight is on a musician, the background musicians are still playing. So just because you have issues with your neck leading to vertigo does not mean the issue is only in the neck. You need to address the whole body. If you have any questions related to this video, make sure you use one of the methods of contact in the description box to contact me. And thank you for subscribing to the channel. Until next time, take care.